So now we are to the revealing of the book. As I said, it was a journey, a very special journey to me personally. Um, Sebastian and me, we met I think 3 years almost, or 2 years ago. First, we emailed and we had the manuscript, and then we met again when the book was finished. And this is a photo of our meeting, and again, there's no words to say. When I was writing the book, I could see Giovanni from every page, and I think it was a very, to me, a special process to take this. Was extensive notes. They were lacking some details, references, and others, but still it was the a good backbone for the book and for the depth of the book. This is the chapters that we are mentioning in the book, started from the history. This is a pure Giovanni's chapter. He was very interested in the wording. Obviously, in ancient China, the word cancer was not as we understand now. Today, we understand cancer as on a molecular level, on a cell level, was not within the Chinese understanding of cancer, but there is a lot of references to how you name it. Then it goes to the etiology and pathology in cancer and the patterns. I'll discuss few in a short lecture, and the diagnostic elements of cancer. Then there's the general approach to cancer in Chinese medicine, giving like the overview, and the big chapter about the integration of the Western treatment, and especially radiotherapy side effects, and then chemotherapy side effects. Because when we treat cancer patient, we don't just see the patient. We have the Western knowledge and the extensive details about the patient's condition, but also these patients are exposed to Western medical treatments, and they alter very much what we see in the clinic and their health, not just during the treatment, but also in the recovery stage and later. We have a chapter about the anti-cancer properties in some herbs, which shows some of the magnitude of research today. Many herbs are very promising also to be developed into pharmaceuticals. I still love to stay in the realms of Chinese medicine and not to move to the realms of pharmaceutical, which has a reductionist view, very different to what we believe and we practice, but we do integrate the holistic view with the reductionist view. And so we do mention the research, some active ingredients, then some nutrition and recipe, which is more like always in Chinese medicine, the difference between herbal medicine and food was linear. So you pass a passage when you use some herbs into food and some foods into medicine. So it's more like a chapter with a lot of things that you can do at home, and then there is an appendix about the modern formula, both from Suen and from my own clinical and research experience that we developed. In this lecture, I want to touch on like 4 different aspects of diagnosis, but also to give some clinical tips to it, or practical that you can apply. So we start with the diagnosis of Bien Bing and Bien Zhen. And this is very much, I'm trying to follow Giovanni's also thought in it, and to show that the difference of when you diagnose cancer with Chinese medicine tools. I'll give a small example from the book about the treatment and the diagnosis of bleeding, which can be very common in many cancer cases. And I'll talk about the diagnosis of channels, especially in breast cancer, and the unique tongue diagnosis of breast cancer. What I always loved about Giovanni's work he had a clear mind. He really present Chinese medicine as a medicine. This is one of the hardest things to explain to the world. Chinese medicine is a pure medicine with all its system. It's not just a treatment method. It's not herbs. It's not acupuncture. It is first of most a very detailed and very precise way to diagnose disease. And there was no one that I know of, like Giovanni, who would always start from very clear differentiation. And Bien Bing always called the disease. It explored the territory of disease. And then what disease you have. So cancer in this respect, you will see it's a complex Bien Bing because there was no clear definition for cancer. And there's like there's for wind cold or wind heat or wind disease. This is a good definition of Bien Bing, that you say wind disease. In the West, it will go later into flu or sinusitis or other problems. So you have already the category of wind, and then you go into the pattern differentiation, which is Bien Zheng. And this is when you go into the pattern differentiation, you understand how the disease developed. And as we know, when we approaching cancer, there is a lot of different options to the pattern differentiation. And the complexity of it is quite big because we have the underlying condition, we have the condition, and sometimes the symptoms. Let's take, for example, the differentiation of bleeding in cancer. This is like from the book. So we know there's different patterns for bleeding. Bleeding can be from heat, from stasis, from toxic heat, from deficiency, like of spleen or a kidney. Each one of them will give different symptoms for the bleeding, and there will be different types of bleeding. And what I'm stating here, because I'm teaching extensively oncology acupuncture, and we have a course that by now we have more than 700 graduates from around the world who are studying with us in depth how to treat oncology patients. And one of the first things I'm saying, a lot of time practitioners, when they hear cancer, they have this black screen. They disassociate from all their knowledge, and they are a bit lost. We always have to come back to the roots. And I think Giovanni in his books and also in the backbones of this book helps us to go back always to the root of Chinese medicine to differentiate whatever we see. So also in bleeding, although there can be different causes in Western medicine, we will still look at the symptoms, we'll look at the tongue, we'll take the pulse, we'll differentiate the correct patterns if we can. For bleeding, relatively, it's easier. For other things, we sometimes have to stretch or to go to the basic. Is it excess or deficiency? And then we can differentiate. At least it's excess, so we treat it in one way, comparing to deficiency. And once we have a different pattern differentiation, we're starting with the basic formula. And the formula will help us to guide to the best herbs that we use over decades and the best combinations of herbs. Then obviously we can alter them according to the patient's condition. But these foundations are helpful now as they've been always. I want to give another example of diagnosis, like of the meridian system. When we diagnose the meridian system, for example, for breast cancer, and in many cases, the differentiation diagnosis of meridian system is important for, especially for acupuncture when we treat. And as we know, there's different channels that are passing the breast. I mean, the obvious one is the stomach channel, but also the liver has a pathway which goes through the breast and actually a certain connection to the nipple itself. There is the heart has an internal pathway. And if we look deeper, we can also find that the connection is also from the other chapters, including the lung channel, which passes in the breast, the internal channels, and they can all influence the qi and the movement of qi in the breast. And sometimes also in different locations of the breast. Obviously, if let's say there is a lump which is passing across a specific channel or internal channel, we take it into consideration both when we treat, but also when we diagnose. A lot of chi stagnation can happen due to and in relation to emotions. It doesn't mean that breast cancer in this case is starting from an emotional condition, but it can be related, and in few cases, it can be also the root of the disease. And if we look at the channel, we can obviously liver is in charge of the free flow of qi, and it passes through the breast and especially to the nipple. I just today had this question from one oncologist that have a patient that has, after surgery and everything, has this nipple pain that nothing can help it. And for us, it's obvious that we will treat it from the liver channel, actually. Can be from the stomach. In her case, all the indications were for the liver channel. And we know that anger, frustration, and guilt can hinder the qi and can affect the breast. And I must say, we live in an era where women are undergoing a lot of stress, much more than men. They have 3 jobs, whatever they do, and even that we are in a better equality situation still. I think women's responsibility and extensive amount of care is creating a lot of frustration and guilt. And in cases, we hear it when we diagnose the patient, and also we hear it in their past history. Stomach and spleen are affected by worry, and all these channels also affected later, because women can have a breast cancer, she undergoing all the treatments, but the feeling were not treated during the treatment of Western medicine. This is the place where Chinese medicine can help in balance. And when we identify a pattern, it is important also to treat it for prevention. The lung relates to sadness, and especially a traumatic sadness can trigger different cancers, and as many specific traumas, okay? Not every trauma. And the heart is related to all the emotions, and especially if there is a deep trauma, it will always affect the heart. And all these channels are passing through the breast and can affect the breast. I just want to stress that it's not just important for the diagnosis, it's extremely important for prevention, because these patterns, as I say, Western medicine knows how to take the cancer out, hopefully, if this is an early diagnosis, knows how to treat it very intensively with radiation later, with radiation or with other strong means. But the pattern themselves, the underlying patterns,
have to wait
are
for
same. For every chi stagnation, especially in the chest, can affect the lung and the heart, and can impact the emotions, and also further affect the chest. I want to add the Chong Mai. Chong Mai is this extra meridian, is extremely important, especially in breast cancer. And the Chong Mai channel also spreads to the chest. And to me, this is many times one of the root in diagnosis of breast cancer, because it relates to hormonal changes, which are, as I say, we are in the Western world, we have a lot of exposure to strange substances which are either hormone or hormone-likes, even plastic. And women are taking pills and exposed to other hormones in excessive condition, and many other examples. And they affect mainly the Chong Mai, and as I said, the Chong Mai spread to the breast and the chest. This is an example of 2 acupuncture points which are meaningful also to prevent qi stagnation in the breast. If we're talking more about the liver perspective, liver 14, which is also have a beautiful name. One of its name can be translated as a gate of hope. It's the last point on the channel system, very much related to the flow from liver 14, which is the last point on the liver channel, to lung 1. So has a deep influence also on the chest and breast and diaphragm. And spleen 21, that is also related to the great luo system, all the small minute channels that also spread to the breast itself in women, And both points are important to treat the health of breast. I must say the book is totally focused on herbal medicine. It does touch on diagnosis and the rest. We're mentioning a few acupuncture points like this, but that's a mainly herbal book. Acupuncture book will probably follow. In tongue diagnosis, there is a chest area, and this area can be seen on the tongue, on both sides of the tongue. Obviously, we have to differentiate that what we see there is not related to the lung or to the heart, but it's more related to the breast. This is within our differential diagnosis. So we do have not immediately a sign there will be purely just related to the breast, but in many cases, and you can see it yourself when you see women with breast cancer, do have a close look at this area and try to see what you can pick up. It's changes in color. So obviously the more red will mean there's more heat pathology, the more purple, the more stagnation pathology, the more pale, maybe deficiency pathology of spleen, etc. We look at the shape, how swollen it is. If there is teeth mark, can relate more to the spleen. If there is spots, it more relates to local stagnation. And all this will be important, not just in the diagnosis of the breast cancer, but as I said, later in prevention, because the pattern can stay even when the cancer was removed. And from our point of view, prevention is always one of the keys where we can provide much more than you can imagine. I'm just now running a research showing in prevention of recurrence of specifically bladder cancer, and already proven it to a certain extent. So in tongue diagnosis, when we look at this chest area, we can see either the spots, which are more showing a local stagnation, or changes in the whole area, which shows the pathology of chi in the body. They're all helping us within this. I must say, if you treat cancer patient, there's a lot of uncomfortable zones, but when you have all these building blocks, you will always find the clarity in the diagnosis and the clarity in the TCM approach to the condition. So this was just a kind of snippet from the book and from what we present there. And I want to finish up with saying Giovanni's legacy lives in the knowledge he shared and in the inspiration he sparked in others. And obviously, it includes all the speakers that spoke today, myself, and thousands of practitioners who I know he touched them and sparked this in them. But, I want to thank you all for joining us. Thank again, Sebastian, and everybody who spoke, and commemorate Giovanni. And I wish you the best of health and healing. All the very best.